Well, welcome everybody. How many people are online right now, Senator Hoffman?
You had looked like 125 on YouTube, and I don't know WebEx, but you can see in front there's lots of folks on WebEx. And
Well, this is remarkable. Good morning, everybody. And I feel like these times are so unique, and I don't even know how to grapple with that. It's unusual to look at an audience full of empty chairs, knowing there's 125 or 30 or more people out there watching. Thank you for joining us. These are really important times. And I feel kind of like we're doing this hearing from a lifeboat. And it's actually not a hearing. It's Senator Hoffman and I having a Tele-Town Hall. I think going forward, we'll be able to formalize this into some sort of working group as I talk to Representative Schultz and Representative Keel and others to make something more formal. But today, this is designed to be a way to address some of the challenges that this COVID tragedy has brought into the world of disability services. This is not a time to bash the department or criticize national efforts or anything like that. This is an effort for the public to weigh in on what they see, the various groups, and for us to begin to hear. And I know a lot of people are listening, and so we had to shrink it down. We had over 24 requests. We worked with the people as best we can to shrink it down to 15 that I thought would be representative of that. And if you need closed captioning, I'm sorry that's not on this, but they said it's going to be added in the replay because that's just a technical thing. I've asked a lot of people, in fact, I've asked every presenter to have a written set of comments with a statement of the concerns and challenges, but also with some solutions that they propose. Some might cost money, and I am totally happy, and not happy, but we're totally good with bringing forward a proposal that will cost some money. This is a critical time. And so if you're on the WebEx, there's two groups. There's the Facebook streamers, is that a term? And then there's the people on WebEx who are participating. If you can keep your phone, your computer muted until your time comes, that would help. Otherwise, just to warn you, if you're unmuted and you sneeze, it's going to go take a picture of you sneezing, and I'm not sure you want that to be on the streaming thing. And so I'll make sure people know who's on deck so you can kind of get ready. And so for starters, I don't know if they're all online yet, but Representative Schultz and Representative Keel are joining us if they're not here yet. There's Representative Keel. Good morning. And so for starters, in this trial run here, we're going to leave Representative Keel and Representative Schultz the freedom to speak when the time is right. Their phones will be unmuted. The other legislators that are on the that are going to be with us here will be muted until we get to the last discussion time. And so the general format is going to be that people have 4 minutes. The commissioner has a little bit more time. But so 4 minutes and kind of 2 minutes to summarize your concerns, and then 2 minutes to summarize what you think we need to do in terms of department action, if that's something that you think they need to hear, or in particularly legislative action as we try to put together some legislation. And so I am just telling you, I feel privileged to be at the helm of this right now, but really sad that we have to have this kind of meeting in this sort of setting. And it's my great privilege to serve with my good friend Senator Hoffman, who's going to offer his thoughts, and then we'll move right into the agenda with Commissioner Harpstead. Senator Hoffman.
Thank you, Senator Abler. And first of all, thank you for thinking outside the box in response to what we see as important issues that are really pertaining to a lot of people in the statewide in Minnesota. And right now there's over 240 people viewing in on YouTube and in the list here. So you know just by that in and of itself and a 2-day notice that you wanted to have this Tele-Town Hall, that there's deep interest. And I'm really looking forward to hearing about not just some of the issues that are out there, but some of the solutions so that we can help out like we did when we did Senate File 4200. The commissioner said we need some authority to do some things, and we absolutely responded well. And thank you, Governor, for taking that language and putting it in there. And hopefully by the end of the day, we can, again, help our commissioner do what's right for people with disabilities in the state of Minnesota. That's my intent for this, and I thank you for doing this. And again, thinking outside the box, Jim, that's what this partnership's about. I appreciate that.
Sweet. And I also meant to really strongly thank Anoka County for coming forward to help in this time. And just to the Senate IT folks, you got to come look at what they got. This is remarkable. We can see on our screens. And clearly, Anoka County is ready for everything. And frankly, one of my favorite counties, Senator Hoffman, you have a soft spot, I think, for them as well.
You're funny.
So thank you. So Commissioner Harpstead, if you're here, are you there? We'd like to hear from you. You were here.
Can you hear me?
We can hear, yes.
Okay.
We can't see you, though. Oh, there you are. Wow, this is amazing. I need a teenager here to help me with this.
This forum, I appreciate it, and I appreciate all that the two of you have done to get us this far during this peacetime emergency. I appreciate that this is the toughest time any of our nonprofit leaders will face in your careers as you look to serve the people you care so much about, and as you work to ensure the survival of your mission. Our priority in this health emergency has been those waivers and accommodations that would make the biggest, most immediate difference to protect the health and safety of the people you all support. Do
we need to, we lost her.
I appreciate the
your mic's still
frustration
on,
that
Jody. Oh, there you are. Go ahead.
I appreciate the frustration that our executive order does not come with financial appropriations to support the infrastructures of your organizations in this uncertain time. I understand that many of your organizations have little margin or operating reserves. We're being very judicious with our decisions, expecting more and more people to enroll in public health care coverage and cash assistance payments in 2020. As I've thought about it over the last week especially, I think the very best thing that nonprofit providers can do right now is to come in with creative ideas about how we might pivot, you might pivot right now to services that are needed most during COVID, so that you can pivot back to your normal work after COVID. For example, the day centers for older adults, I would really appreciate it if you could tell us how many people you normally support and how many of them are now home alone. It would be helpful to have that data. And how are we all going to work together to keep those people safe at home? So I'm wondering, for example, could the day centers for older adults become home PCA providers for a while? Could day centers for people with disabilities do some of their work in group home setting? The non-emergency medical transportation go to work delivering the recently approved 90-day prescriptions to people's doorsteps. We'll continue to think this way on your behalf, but we really need you to think creatively this way as well and come to us with creative ideas. There's no bad idea and there's no wrong door. You can continue to contact the people you normally work with in the Department of Human Services, send ideas into this setting here, and we'll collect them that way. However you can get us ideas, we need them all. And I appreciate the extra time you allotted me, but I'm going to stop here and just listen and take notes. Thanks again for this opportunity.
Thank you, Jody.
And thank you, Commissioner. And I understand you may have to leave, but Mr. Burdick is going to be keeping tabs, I understand. So any comments from the four leads for the Commissioner? I think you can just, I don't know how, just speak up if you want to, and we'll try to just keep it in order. Senator Hoffman, for starters, since I can see you.
Thank you, Senator Abler. Thank you, Commissioner. And I'm so happy that you're on today, and I'm so glad to hear you talk about thinking creatively as well, because these are unnerving times. We just don't know what's going on. But the idea of pivoting those services needed, and I think today we're going to come away with some, hopefully some good ideas that the department can take into consideration, and then if needed, if there's some help from us, that's why we're here as well. But I appreciate hearing your thoughts.
Representatives Keel or Schultz, are you there? You want to say anything?
This is Representative Keel. Can you hear me?
Yes, we can.
Awesome. Just my concerns are I couldn't get a hold of a couple of my day providers. They were doing some out of the box suggesting when we were going into this. I did not talk to her. They were trying to do some way of checking into people that were home alone or didn't have quite the services. I wish I knew what was going on there, but there was some concern about protection for those staff that were going to be going into homes. And that was their director's. I'm the board handling that. So, and I too want to thank both of our senators for this opportunity to just talk about what's going on. Makes it easier for us to know what's going on in the state. So, thank you.
And Representative Schultz, are you online with us? Okay, do you want to say anything right now, like hello or to the commissioner? So I don't know about the technology, but and just to reiterate, I'm Commissioner. I'm really happy that that you're the one who's there. I'm very confident in your ability. I can't imagine the workload and the burden you've got. So we're absolutely here to help you out. So with that, we're going to move into we're going to kind of go down as a more of an ordinary hearing thing where we'll listen. If each testifier could talk for 4 minutes, just kind of start to finish, give us a hint of what challenges you see, but focus on at least 2 minutes on the solutions. And then we can get through that in about an hour, and that'll leave us some time. If you can hang around, we can try to discuss. So, Julie Johnson, are you there?
Good morning, everybody.
Good morning. Yeah, go ahead.
Thank you for this opportunity to gather and talk about our concerns. My name is Julie Johnson, and I'm the president of the Minnesota Organization for Habilitation and Rehabilitation, known as MORE. MORE is comprised of more than 100 day and employment service providers from across the state. MORE members support more than 26,000 Minnesotans with disabilities each day. I'm also the president of MSS, a day and employment service provider supporting over 550 individuals with IDD each year, employing about 160 staff. I hear the toll of the COVID-19 pandemic that is taking every day on MORE members throughout the state of Minnesota who have had to suspend their services. MSS services have been suspended since March 17th when we received the direction from the Minnesota Department of Health not to have people with complex health needs in groups of 10 or more. We are very supportive of the community effort to slow the spread of the virus and keep the communities healthy, and knew suspending our services was the right thing to do. Our disability services, day and employment service providers, is being hit particularly hard by the effects of this virus. Many day and employment service providers have had to suspend their services in order to minimize the risk of infection to the medically vulnerable individuals they support. These providers help people with disabilities learn about employment, join the workforce, and connect more deeply with their local communities, and enrich the lives with opportunities such as creating art and staying physically active. Day and employment service providers are only paid when services are provided. These providers across the state are nonprofits with little cash reserves in case of emergencies such as this. Fixed costs such as rent payments, payments for vehicles, and utilities continue, even if the services aren't being provided. The longer these providers are forced to suspend or reduce services, the greater the chance that some of them may not be able to reopen their doors once it's safe to do so. We simply cannot come back from the crisis with a decimated infrastructure for these crucial disability community services where people with disabilities will not have access to these innovative, individualized supports during the day. We must ensure that the service structure remains viable when we get through this pandemic. Lynn Noren from RISE will talk a little bit more about our proposed solution for this.
Well, thank you very much. And Representative Schultz's microphone is not working, so maybe if you would just want to text me, Jennifer, and then I'll read your texts as they come up. And I saw you sent some message which has now gone off my screen. Thank you, Ms. Johnson. And so, Ms. Noren, welcome to the committee, welcome to the Tele-Town Hall. It's not a committee. So.
Good morning. Good morning, Senators. Thank you so much for the opportunity to present to you today. My name is Lynn Noren, and as Julie said, I'm the president of RISE, a disability services provider that serves over 3,500 people who have disabilities each year in the metro and central regions of the state. So our request to you today is for emergency relief to cover the fixed cost our organizations continue to experience during the time our services are suspended. Without assistance, the very infrastructure of service delivery to people who use these services could crumble, with some providers, especially some small providers in greater Minnesota communities, needing to ultimately close their operations and potentially not being able to reopen. Governor Walz used Executive Order 20-12 to give the Minnesota Department of Human Services broad temporary authority to modify existing law to ensure that service providers can weather this storm. And we at MORE have been working hard to develop a proposal that we have shared with Commissioner Harpstead and her team in support of day and employment service providers on Monday. At this time, we have not heard back yet about our proposal yet from the department. The proposal uses the DWRS rate methodology to identify the fixed cost values in the rate formulas and requests that day and employment service providers be reimbursed for those fixed costs during this time when our services are suspended. We provided a spreadsheet to you, Senator Abler, and to the department that demonstrates the portion of each rate that represents fixed cost by staffing ratio of the person served. On average, the fixed costs represent about 50% of the total rate. We have requested technical assistance from the department on our proposal to assure the calculations match their understanding of the rate methodology. One example of fixed costs that remain for providers is health insurance. We are continuing to provide health insurance and other benefits to all of our RISE team members, including those that are furloughed, as are most other providers, because these staff need the coverage and they are our most valuable asset and so important to the lives of people that we serve. You may have heard that during this challenging time, many day service providers like RISE and MSS are loaning their staff team members to residential providers. For those team members who can do this, it's a great support to the homes and an alternative to unemployment for the team member. Not everybody can participate in this, however, due to challenges with childcare and other considerations. This practice covers the wages and costs of administration related to the loaned employee. It does not minimize the challenge we face to cover our fixed costs at this time. We have also been in communication with the department about providing remote services, as Commissioner Harpstead mentioned. At this time, we have not received final approval to begin these services, and therefore we have not been able to predict their impact on our financial situation. I can say, however, that we would not bill a fixed cost rate for any individual who has another day support being provided on the same day. People are in need of these supports, and we need the guidance to come soon from DHS. In summary, we need your help to take action to provide emergency relief to day and employment service providers. The 26,000 individuals with disabilities who access our services to live safely and thrive in our communities depend on us to be able to support them in new and innovative ways during this pandemic, and to allow us to still be there to support them when the pandemic passes. Please partner with us to make this possible. Any questions?
Well, thank you. Thanks, Lynn. I think we'll maybe just take brief comments from the four of us on each cluster of topics, just so I think that would be appropriate. Otherwise, we'll get too many topics together. Senator Hoffman.
Senator Abler, Lynn, the proposal you're talking about, fixed costs, there are other states, correct, that have already done this, like Wisconsin, Connecticut, and Pennsylvania. Is that correct?
Yes, there are, and we have provided that information to the Department of Human Services as well. RISE provides services in Western Wisconsin, and we have received information from our funder about covering a portion of the cost up to $50 a day for services that we are unable to provide this time due to the closures.
All right, thank you.
And Representative Schultz sent a text. Is it feasible for day treatment staff?
Hey, Jim, can you hear me now?
Oh, are you back? Oh,
I am. I figured out
Hooray.
my technology problem. So I was just wondering, the commissioner mentioned that the possibility of those folks working in day treatment facilities, that they could transition to become direct support professionals for people who are needing services at home. And I'm just wondering the amount of training that's needed, because I was told it could be fairly extensive. And if we can expedite or provide that training in a way that they could get it quicker and we could get them out into people's homes to provide care.
Ms. Noren, do you want to comment about that?
Yeah, we've been on regular calls with the Department of Human Services to talk about the requirements of providing services in people's homes. And as I said in my testimony, many providers are already doing that, loaning our team members to support the schedules in the homes. And we would like to provide day supports to homes as well. And we believe that the training has already been handled for all of these employees. We all are under 245D licensing requirements. So it wouldn't be any different to provide services remotely or in other alternative ways in their homes. We just need the authority to do that from the department.
I think it's important to clarify that the fixed costs are different from the staff costs. And Commissioner Harpstead mentioned moving staff in this very way to serve elsewhere. And but we still need to handle the fixed costs. And just for my sake, I think that addressing the fixed costs, I'm very friendly to that. That would seems like, and it's not horribly expensive. So, anything else on this topic? Any of the four? Senator Hoffman.
Thank you, Senator Abler. And I think on that fixed cost conversation, that's forecasted money. That isn't any new money. So that's money that's already been forecasted, which would then not be any kind of new money coming out of the reserves.
Yeah, good point. Well, thank you for this topic. Let's move on to Sarah Grafstrom and ARM, which is another whole massive area. So, Ms. Grafstrom, welcome if you're there.
Hi, good morning. Can you hear me?
Yes, we can. Welcome.
Great. Thank you. My name is Sarah Grafstrom. I'm representing ARM, the statewide trade association for residential providers supporting individuals with disabilities and mental health support needs. Along with the rest of the country, we are walking through this uncharted territory and taking each new challenge and obstacle that is presented on a day-by-day basis. The challenges I share that we are facing today were different yesterday and no doubt will be different tomorrow. Our paramount concern is that of the health and safety of the individuals we support and the staff that we employ. Ensuring that our essential workers feel like they have the appropriate and necessary resources when they go to work every day is one of our members' top priorities. To that extent, here are some of the challenges and solutions I'd like to share with you. Providers are worried about ballooning unfunded costs. With individuals staying home all day due to the recent closure of day services, the need for staffing, food, utility usage, household supplies, and PPE have all increased dramatically. The recent temporary increase to housing supports that was contained in the COVID relief bill passed last week will help, but will not cover all additional costs. ARM has joined with a coalition of other members of the disability community to draft legislation that would create a grant program accessible for organizations with unfunded costs due to the COVID crisis. We would strongly urge legislators to look closely at this legislation as a potential lifeline for organizations. Providers are also worried about the cost to their staff. With additional shifts being needed to cover the additional time at home, many providers are paying significant overtime to a workforce that was already stretched to the max with over 18,000 job openings statewide. Additionally, we are asking our DSPs, often paid wages between $11 and $13 an hour, to leave their homes when the rest of the state is told to shelter in place and provide critical support to individuals with disabilities. ARM strongly supports Senator Ralph's legislation that would provide hazard pay to these staff, acknowledging the critical support they are providing. I had a member share with me just yesterday that his organization has already temporarily raised wages by $2 an hour in an effort to acknowledge this important work and keep staff from leaving. This increase, however, will cost his organization an additional $150,000 a month of unreimbursed costs. Without knowing how long this crisis will continue, it is critical that the state support legislation that would fund hazard pay for direct support professionals. And finally, providers are worried about the lack of a crisis plan. Members are consistently looking to us to provide guidance on what to do if an individual is diagnosed with COVID-19, resulting in no staff wanting to go into the home to support that person or the others they live with. Our industry has not been categorized as a top priority for PPE. However, as a community supporting individuals with oftentimes complex medical needs, it is essential that our workforce have the same protection as other healthcare professionals. I understand that this is not a problem isolated to disability services or even the state of Minnesota, but a problem we are facing nationwide. However, it is critical that as we are distributing limited resources across the state, that disability service providers are recognized as essential healthcare workers and receive the needed PPE to provide those critical supports. With that, I just want to thank you for your time, and I'm happy to answer any questions or provide more information if needed.
Well, thank you very much. And we could use the rest of the time to on this single topic, but we just this is really helpful overview. Have you noticed with places closing that people are wanting to come into your sector, at least temporarily, to be employees, or do you not see that shift coming?
I think anecdotally, we've heard some of our providers say they're getting a few more applicants. We're still waiting on guidance from the department as to how to administer background studies. We're seeing lots of the fingerprinting locations closing down. And so I know there was legislation passed in the COVID relief bill that would help with that, but we're still waiting on that official guidance. So yes, we are seeing a few more folks. We've also, ARM, along with the Best Life Alliance, has started a new campaign called Meet the Need Minnesota, which is really aimed at targeting those potential employees that may be out of work right now that can come in and provide some of these critical supports. And so we're really trying to attack the problem from all different angles.
Well, super. And I think you have something you're providing us in writing as well. So, and I know you're working with the House. Any other comments from the other leads? Okay. Thank you. So let's move on. Mr. Pinsky, are you here?
Yes, good morning, Senator Abler.
Oh.
Can you hear me?
Yeah, go ahead. Yeah.
Okay, thank
And
you.
you look good on, it's interesting to have the statewide tour of everybody's house. This is really unnerving to me, frankly, but welcome to the town hall.
Thank you very much. My colleagues and I are grateful for this opportunity, Senator Abler, to address the needs of the NEMT industry so that we may ensure the continuity of services for the vulnerable populations that we serve. My name is Mike Pinsky. I'm the president of the Minnesota R80 NEMT Alliance, and I represent NEMT providers across Minnesota's rural 80 counties. I'm also an NEMT provider myself, based in Mankato, and serving 10 South Central Minnesota counties, and have been providing NEMT services for 27 years. As you know, we are living in unprecedented times, and rural NEMT providers are faced with unprecedented challenges as we work towards preserving the rural transportation infrastructure. Experienced NEMT business owners are actively taking steps to protect their drivers and their riders, as well as taking steps to ensure sustainability of their services during this time. However, cancellation rates for NEMT services have approached 80% for many providers, and providers are actively parking vehicles, canceling the insurance on those vehicles, and are furloughing drivers, customer service reps, dispatchers, and other key employees. This is not a sustainable situation during this time of evolving challenges and threatens the readiness of the transportation infrastructure post-outbreak. We have made significant efforts to resolve this situation, and to be clear, we have been in communication with DHS, including the Commissioner's Office. We have communicated with and sent a letter to the Minnesota Council of Health Plans. We've communicated with county emergency management directors. We have communicated with various EMS services and have communicated with the Governor's Office and the Governor's Emergency Operations Center, most all of whom have stated that our continued operation at this time is critical. It is of vital importance that we maintain an operational NEMT infrastructure for moving patients during this time, and that NEMT serve the role it was designed for. However, this can only be accomplished if DHS takes immediate action to preserve the rural NEMT infrastructure. I want to tell you that in no uncertain terms, the rural NEMT infrastructure is approaching collapse. And without intervention by DHS and the health plans, providers simply do not have the resources to continue to operate. The shuttering of NEMT services across rural Minnesota would only add to the chaos and the uncertainty, and will have a devastating effect on those dependent upon accessing life-saving treatments. I believe we need an immediate strategy that will ensure operational integrity for NEMT in the short term during this crisis, and one that will ensure a robust and responsive NEMT industry on the back end when there is likely to be a massive backlog of transportation needs. This strategy would include identifying critical transports such as dialysis, oncology, lab, hospital discharges, and transfers, which should continue at this time. It would also include identifying willing and able NEMT providers capable of meeting these critical transport needs, and in turn provide financial relief in the form of reimbursement incentives to these identified providers. Rest assured that your NEMT network are committed to the communities that we serve and stand ready to support our first responders and healthcare infrastructure, but cannot continue without action. COVID-19 is likely to change NEMT forever, and now is the time to make sure we change it for the better and recognize NEMT as the essential service we all know it to be. I'd like to thank the Governor's Office and the Emergency Operations Center for the guidance that they have provided us during this difficult time. And we are hopeful that DHS and other payers will recognize the value of preserving the NEMT network on behalf of their members. And I thank you.
This is much more complicated than we can do in 5 minutes. Do you have a proposal that's specific about what you would like us to do in terms of a rate thing? And just let me step back a bit. There's some concern about paying people to do nothing. If you look at the unemployment work that we're doing, we're meeting families' costs while they don't work. And so there's that. I think that idea doesn't hold water anymore. I think part of what we have to do is preserve the infrastructure, both in the DT&H side, the group homes, whatever they have to need, and the day services and employment services. We'll talk about that, and your niche and the rest as well. And that may mean funding fixed costs for some folks. So can you talk about the fixed costs that you have? Let's say that you don't drive, and never mind the drivers right now. Can you discuss the fixed costs that your providers have, especially the larger ones?
Sure, I'd be happy to. So the best way for me to describe this at this point would be to talk about my individual business. We operate 52 vehicles on a daily basis and provide over 400 rides on a daily basis. Currently, 38 of those vehicles are parked, and we have taken the insurance off of them, and 38 of those drivers have been furloughed. We had an office staff that was in excess of 12 people. That is down to 4. The fixed costs that exist, of course, are maintaining insurance, maintaining the vehicles, maintaining the key members of our staff. For example, closing down and shuttering that many vehicles, I still have to maintain my maintenance crew to make sure that any existing vehicles are being able to be serviced. And insurance continues, and all of our fixed costs, such as vehicle payments, rent payments, et cetera, continue. As far as what we're looking for relief, Senator Abler, is we believe there needs to be an increase in rates. We also believe that there needs to be a COVID operation fee. And we're looking for guidance and help from the department and other payers. Something as simple as the signature requirement that we have right now, we cannot get clarification. We're required to capture signatures when we provide the service. However, currently many riders and members are refusing to sign, but we don't have any clear guidance from the department as to whether or not we can waive signatures at this time. So we continue to provide services in a very difficult time, but are lacking some of the guidance that we need so that we could simply stop handing pens and paper and tablets back and forth. So we have a lot of ideas. One thing that we recognized as well, NEMT has not been deemed specifically an essential service under any of the governor's executive orders. We believe that we're encompassed or captured in some of those other headings. But we would certainly like and believe that NEMT should be considered an essential service during this time.
Appreciate that,
Chair,
and I
this is
think there's.
Representative Keel.
Go ahead. Yeah.
I have to bow out for about 20 minutes here, but this is really important to my neighborhood, and I wanted to point out something. When we think about driving people, I've actually used service. My aunt, who is now deceased, had to be transported. She was not. I could not move wheelchair to car, so I used RNL, which is our district's services. We drove to Fargo, which was 85 miles away. I was the family member who attended with her, but she could never have signed a paper. I don't think she would have understood what to do, much less do it. And then was in a wheelchair that I could not transport her. So I wanted to point that out. And I'll be watching, but I'll bow out for a little bit.
Thanks. That's good you could join us. I think part of what we should be just thinking about as well are some of the unintended consequences of some of these stay-at-home and essential, non-essential orders that have been made, some of which, and I support, that we're distancing ourselves and people are not moving around very much. And the purpose of this discussion is not to bring that up very much, but there are some consequences of decisions that have been made that have not been considered by the people making the decisions as they consider safety. But then I don't think the effects on the human services, particularly the niches we have here, have been fully considered. Case in point, the non-emergency medical transportation, which if it's misnamed, if some of those rides don't run, the people will die eventually for a lack of care of their particular monitoring their conditions and so on. So just I have one more question, and then we'll take other questions and then move along. Mike, Mr. Pinsky, are your fixed costs like maybe a third of your expenses or something like that? Counting staff and everything?
Well, so.
Just a ballpark. This is not a.
Yeah, well, so I would say that an average NEMT provider of this size that my company is, Senator, has a margin of approximately 10%. At this point, we are barely generating enough revenue to just cover our labor expenses, so we have nothing to cover fixed expenses.
No, that's not my question. I'm not talking about today. I'm talking about when you're operating. So you have your payments and insurance and all those costs. You have your staff costs, which will be whatever chunk they are. So what do you know what percentage of your operation your staff costs run last month or last year? Just a ballpark.
Yeah. Payroll's typically about 55% of my annual budget.
Okay. And so if we were going to keep your fixed costs whole, it would cost something on the order of 40% or better of the whole NEMT cost. If we were talking on the DTNH is about some kind of fixed cost approach. Just thinking that out loud, and so we can take this offline, I suppose. But go ahead.
I would. That's accurate, Senator.
Thank you.
Thank you.
Any other questions from the Representative Schultz or Hoffman? Okay, let's move on. Thank you. And if you have those proposals, I think we want to get those going pretty quick. There's talk about we want to get these sorted out by Monday suddenly, but we'll see if that really comes to be true. But we're moving along. So Ms. Zuber, welcome to the, thanks Mike. God bless you guys. Ms. Zuber, welcome to the town hall. Are you there?
Hi, good morning. Can you hear me?
Yeah, it's great. Good to see you.
Okay, good. You too.
Nice house.
Yeah. House tour, like you said, of the state. So Chair Abler and Senator Hoffman, thank you so much for the opportunity to speak today and for providing a platform for members of the disability community to connect. It is so important that we come together to draw on our shared strength and resiliency to get through these unprecedented times. I want to thank the disability community members who have been represented on this call so far for all that you're doing during this time. So I'm Andrea Zuber. I'm the CEO of the ARC Minnesota, a statewide advocacy organization that promotes and protects the human rights of people with intellectual and developmental disabilities. And as the COVID-19 outbreak has progressed, our team at the ARC Minnesota has heard daily from hundreds of people with disabilities and their families across the state. We have a whole new line of business now, COVID-19 support. We hear about 4 main concerns related to their health and well-being. Number 1 is discriminatory rationing of healthcare. Disability-based discrimination or rationing of care is a real threat facing individuals with disabilities of all ages. Number 2, preservation of disability rights. We've been hearing from members about policies that are being implemented that unduly restrict individuals' rights in an attempt to keep them safe during this virus. Number 3, access to personal care assistance or PCA services. Because of Minnesota's heavy reliance on a direct support workforce, people are adamant about ensuring that PCAs are able to come into their homes. And number 4, institutionalization. Due to lack of access to childcare, crisis respite, and other behavioral supports during this crisis, there are growing concerns about placement in institutional settings. So in light of these concerns, promoting the human rights of people with disabilities and continuing to shine a spotlight on their strength and capacity and wisdom and resiliency has become more important than ever. We know that people with disabilities are important and strong and capable members of our society, and we cannot revert to old thinking during this time. Science and research and technology have taught us that people with disabilities can and are working and living in their own homes and accessing modern transportation options, falling in love, having families, and living the American dream. And we have to understand and remember that now more than ever. So we're all being encouraged to stay home and socially distance ourselves in order to delay the peak of this epidemic. However, the burden of doing so must not fall more heavily on the shoulders of individuals with disabilities than the rest of us. They must be supported in connecting with loved ones, getting fresh air and exercise, and engaging in other essential functions of daily life. This is currently being denied to many people with disabilities under the pretext of COVID-19. The Department of Human Services needs to issue guidance that not only conforms with recommendations from the Centers for Disease Control, CMS, the Minnesota Department of Health, but also aligns with the Americans with Disabilities Act, Minnesota's Olmstead decision, the Home and Community-Based Services Rule, Minnesota's Employment First policy, and other flagship disability rights policies. No matter what, we must not revert back to our history of isolating and segregating and othering people with disabilities. We must use this crisis to grow stronger and do better, leveraging the opportunity for truly creative and innovative reform of our service systems. Several bills moving through the legislative process earlier this session sought to do just that. First, Senate File 3782, codifying employment first, independent living first, and self-direction first policies and statute. Language in this bill regarding Waiver Reimagine project could and should be strengthened to drive us further towards a system of individualized and self-directed services and supports. Second, House File 2971 and Senate File 3003, building on collaboration between DHS and MDE to improve competitive integrated employment outcomes for individuals with disabilities statewide. The stakeholder engagement, data collection, and development of legislative recommendations outlined in this bill is going to be vital as we transition to a new normal after the spread of this virus slows. Finally, the ARC Minnesota recommends the development of a new legislative proposal establishing a legislative task force or stakeholder working group to truly re-envision the future of disability services in our state. If nothing else, this pandemic has demonstrated that, in line what we hear with people with disabilities themselves, and especially young people who are our future, we must advance individualized, self-directed services that foster employment and independent living and promote belonging and community through a robust network of informal supports. As I have said many times before, people with disabilities and their family members have capacity, resiliency, and wisdom that must be leveraged to get us through these challenging times. I'm confident that if we work together and envision a bright future, we can and will come out of this even stronger and more united.
Thank you, Andrea. I absolutely want to echo a portion that you talked about. There was a bulletin, March 28th, 2020, there was a bulletin that was put out by the Office of Civil Rights and the U.S. Department of Health and Human Services to provide a bulletin to ensure entities covered by civil rights authorities keep in mind the obligations under laws and regulations that prohibit the discrimination based upon disability and exercised a whole list of what you're dealing with. And I think we must continue to remind ourselves that you can't separate or make a decision based upon that characteristic that the individual has, and specifically this that was established in that came out by the HHS federally reminds states we must adhere to that. So thank you for bringing that to this conversation.
And Ms. Zuber, I appreciate you coming today, and I really appreciate your reminder of what actions we need to be doing and keeping in mind, even in this time of like emergency crisis, that we want to respect all these individuals, and not just rights, but their humanity. That's what I see the heart of this, and so. And I think that the commissioner has been trying to do that, and I would appreciate you overseeing what they're doing. Just so you know, the executive order and Senate File 4200 allow that if two of us object, that it can't go forward. And so if you see something you're concerned about, you have a strong voice that represents all kinds of people. So I'm interested in that. Representative Schultz, do you want to comment at all?
Yes, I would. I just want to thank everyone for providing us more information on what your needs are. And I would encourage you to get me those needs as soon as possible, because we need to if we need legislation, we need to get it drafted, and we need all caucuses supporting it by Monday evening as we look towards a legislative session on April 14th or possibly sooner. So I know DHS, we've given them a lot of authority to change and waive policies and to try to address emergency needs. But for example, Representative Lippert and Senator Ralph, they're working on language for a temporary increase in PCA rates, because a rate increase is much more, captures federal funding, whereas if we just initiate grant payments, we don't capture federal funding. So we're looking at ways we can capture more federal funding through rate increases, even if it's temporary, to address the COVID response. So please send me your needs today or tomorrow, so we can, if we need to, draft legislation and get all caucuses to support it. So that's what I need. And then contact Representative Lippert and Senator Ralph if you want to review their legislation or add to it. Thank you.
Thanks, Jennifer. And so just to summarize the first chunk here, a lot of things we've heard about, keeping this whole network of supports intact is all about protecting the humanity of the individuals we're serving. And so this is a clunky time, and no one intends to step on any rights, I don't think, at all. And we have to be practical, but we also want to remember we don't want to get stuck in this rut and take any steps back. So, Ms. Zuber, thank you for that. Let's keep moving, and we're doing pretty well here. Is Melinda Wadzina there, please?
Yes, I'm on the line. Can you hear me?
Yeah, welcome.
Thank you. Good morning. My name is Melinda Wadzina, and I am the Chief Operations Officer at MRCI. We provide day programming and employment services across 7 southern metro and south central Minnesota locations to over 1,400 individuals with disabilities. 62% of those individuals are enrolled in programs governed by DHS, and 38% are enrolled in services governed by DEED. On March 18th, MRCI suspended most of its client programming to help prevent the transmission of COVID-19. We are continuing to support competitively employed clients in community jobs or those seeking work. All other programming has been suspended, including our facility-based vocational programs, our group-based community vocational programs, and our day service programming. We temporarily laid off 330 employees. We are paying out all accrued leave and will not interrupt health insurance benefits for our employees. We have partnered with several residential providers to share our staff while our programming is suspended, and we look forward to the day we can call back our team members and open the doors for our clients to return. In the meantime, we are concerned, deeply concerned. We are worried about how we will pay the mortgage and utilities on our buildings, continue payments on our fleet vehicles, and cover our payroll and benefit liabilities, including our unemployment insurance reimbursable account, which is of great concern as claims rise and accrued leave runs out. We have costs that continue even if our programming does not. And as you've already heard, we are not alone. I was on a call yesterday with 5 other providers in South Central Minnesota, All had suspended programming and all had laid off or furloughed staff. The biggest concerns voiced were financial solvency and retention of staff for when business can resume. Protecting the infrastructure of disability service providers is critical to upholding Minnesota's commitment to people with disabilities. As service providers, we uphold Minnesota's Olmstead Plan and Employment First policy by providing community integration activities, vocational training, and job placement services to individuals with disabilities. If providers are not financially supported to survive this crisis, the current infrastructure of disability day and employment service providers will not be here when the COVID situation is over. MRCI supports the Moore Association proposal for a 50% rate reimbursement during suspended programming. Helping offset the fixed costs of organizations will help ensure the infrastructure of disability service providers survives the COVID situation. Secondly, we support DHS's decision to allow remote services during the COVID situation. We have many clients who would immediately benefit from this opportunity, especially those with mental health concerns. It would also allow us to bring back staff from layoff to provide these remote services, which helps us ensure retention for when full business resumes. However, we need DHS guidance to take advantage of this opportunity, and we anxiously await this much-needed guidance before we can begin. In closing, Minnesota has a remarkable infrastructure of disability service providers across the state. We must be supported to make it through this crisis, or Minnesota's commitment to people with disabilities will be negatively impacted. Thank you for the opportunity to speak today, and we appreciate your consideration and support on these matters.
Thanks. So stand by. Let's take all the testifiers on this topic, and then we'll discuss it a bit. So if Ms. Hammond is there, welcome to the town hall. Are you there? Okay. Oh, your mic's open, Ms. Hammond. So are you there? I feel like Larry King on a bad comm day here.
She's on the computer in WebEx. She doesn't have a mic. She's on the phone line. I sent a message.
Okay, she's on the phone line. So do you, okay. And the staff here at the county is just remarkable. They have, we're practicing distancing. Go ahead. And so they're, but this is just really a way for the different groups to work together. So. Okay, Miss Hammond, go ahead. We've got you.
Oh, hi, thank you. Senators Abler and Hoffman, I wanted to thank you for your time today and your continued advocacy for individuals with disabilities. My name is Karen Hammond. I am a senior director for Dungarvan, Minnesota. Dungarvan is a disability service provider providing a wide range of supports, including residential, in-home, supported employment, and supported housing, just to name a few. We can all agree that direct support professionals are the backbone of the services we provide. Without their commitment and dedication, many of our most vulnerable Minnesotans would be forced to live and work in significantly substandard conditions. We rely on these committed professionals to assist with tasks both small and large, from grocery shopping and job support to providing the most basic and intimate of cares. Our ability to adequately pay these professionals is sorely limited by current state-allowed reimbursement rates. Under normal circumstances, we are faced with a shortage of nearly 19,000 disability service workers. As we enter a time of unprecedented uncertainty, this shortage is magnified. These professionals are deemed essential employees, and none of us would disagree with that. Now we are further faced with asking these professionals to work in close contact with individuals who are at high risk for the COVID-19 virus. We are asking them to do this with limited personal protective equipment. We are asking them to put themselves at risk working with individuals who, while quarantined, continue to need support meeting their most basic of needs. You asked us for solutions. The ideal solution is to permanently increase reimbursement to providers so we can pay these professionals a living wage. To recognize and acknowledge they should not have to work 2 and 3 jobs to support themselves. To allow us to recruit and hire the best of the best to work with our most vulnerable citizens. To ensure this is a viable career path, not a starter job. But we're in trying times. My ask of you, Senator, is to fund an increase, even if temporary, to allow us to pay these essential employees for the critical work they do and for the personal sacrifices they are making. Doing this would be a reflection of Minnesota values and quite simply the right thing to do. The legislature could fund a temporary increase, hazard pay, as we've called it, if you will, in the framework work wage line. This would allow us to pay enhanced wages across the board. Another option would be to modify the exception process to pay an enhanced wage to staff who are being asked to work with individuals or in homes where an outbreak has occurred. Whatever the solution, it is essential that the process be streamlined and efficient in order to be proactive rather than reactive. I also wanted to thank my colleagues in the day services who have been providing us with staff to step in and help. The collaboration is providing effective and is helping us to meet this essential need, but we still are very, very short-staffed. Thank you for your time, Senators.
Thank you, and I appreciate that. I just want to offer one thought before we get too far into this. The term hazard pay is a term that we should probably move away from. Just think of another word, COVID pay or something, but let's just keep listening to folks. Thank you very much. Ms. Schlutenhofer, are you there?
Okay, I'm on. Can you hear me?
Yeah, this is great. Please.
Yeah, I'm really impressed with your pronunciation, by the way.
Oh. Welcome.
Yeah, thank you. Thank you to the commissioners, senators, and representatives on the call. My name is Lori Schlutenhofer, and I am the Vice President of Day and Employment Services with Opportunity Partners. We're a metro area disability provider that touches the lives of well over 1,000 people each year in their homes, in their communities, and where they work. Right now, OP is continuing to support 300 people in their own homes and in group homes, as well as another 100 people who are either continuing to work in jobs deemed essential and also supporting those who have become unemployed to apply for benefits and ensure that they have adequate supports as they shelter in place. Opportunity Partners is also a member of MORE, and I have the privilege of serving on the board of that organization. Like other providers, on March 19th, following the guidance of the Department of Health, we suspended services at all of our day service locations, impacting the lives of 750 people with intellectual and developmental disabilities, brain injuries, and mental health challenges. In addition, over 200 of our valued employees have either been furloughed or redeployed to support individuals in our own group homes, as well as those of our partner providers. As you've heard earlier from Julie and Lynn and Melinda, we are doing what's right to best protect the health of the people we serve and slow the spread of COVID-19 in our community. But these shuttered services for Opportunity Partners represent 60% of our annual revenue. And that's revenue that's no longer coming in, and it does not cover our fixed and continuing costs, like facilities, vehicles, insurance, technology infrastructure, and most importantly, the health insurance for furloughed and redeployed staff. Like many of MORE's nonprofit organizations, Opportunity Partners is self-insured for unemployment. Unfortunately, these costs are also uncompensated, but they are not fixed at all. They're exploding. While we wait to hear details from the state of the relief coming for self-insured organizations, we are forecasting that our obligation for these necessary benefits for employees unable to work will increase well over 500%. We are not only requesting help to cover fixed costs during this time, we are also eager to move forward innovative ideas to provide services remotely to support a lengthy period of social distancing in our community. While we have been in communication with the Department of Human Services about providing these services, we have yet to receive approval to move forward. On behalf of Opportunity Partners and our partner organizations across the state, I ask for your help. Our shared imperative is to continue to find and approve new ways to serve people with disabilities during this pandemic, as well as when we make it to the other side. And we will. When we get there, let's make sure that we still have the infrastructure to do so. Thank you for your time.
Well, thank you very much. And I presume the microphones are open for all three of you, which would be if Dave can make sure that those three can be speaking. Can one of you tell me how many positions, these community positions where people have been placed in employment, so whatever, working at a company or someplace, how many of those, what percentage are closed because the businesses are closed? And how many are not able to be there just because you're voluntarily keeping them away? Can somebody comment about that?
This is Lynn Noren, Senator Abler.
Yes.
At RISE, some of our community job sites continue to operate because the work is considered essential. People who have competitive jobs also. So I would say we're probably serving about 100 people a day still in their community jobs. And we're providing transportation on a very limited basis to those individuals as well. But that represents, like less than 5% of our total service population, probably.
So the large majority are not working because those companies have been considered not essential and the job doesn't exist for them. Is that correct?
Yes.
Thank you.
Yes, that is correct.
Senator Hoffman or Representative Schultz?
Thank you, Senator Abler. And it absolutely is it's important that this still continue to be on topic with the discussion here. And I'm thankful that these three folks, I did hear in one organization where they had their employment, individualized employment services. As of last week, they did have over 200 individuals that were receiving minimum to prevailing wage in the community, and 80 of those individuals had lost their jobs. And so then when you furloughed the individuals that were helping folks find that individualized employment, the Employment First Initiative, there's nobody out there helping them, getting the access to that supported employment piece that's missing out there. So this is important stuff.
Representative Schultz, do you want to comment?
Yeah, I just have a question. I'm wondering if any of these organizations have been applying for the business loans that are available through the state and the federal government.
Oh. Go ahead.
This is Melinda with MRCI. We have. We're in the process of doing the SBA loan as well as the Payroll Protection Act opportunities as well. And then there's some emergency grants that we're also looking at and submitting to some of the foundations that have put those together in the state of Minnesota.
But again, I think it's important to remember there's two components. There's the payroll, which part, but then there's also the fixed cost part. Mm-hmm. And so many of the employees can be covered through some PTO or unemployment or whatever. That's gotten generous but confusing. But the fixed costs are really what's going to take some of you all down. So,
Exactly.
Anybody else want to comment about this niche?
I just wanted to say in response, this is Lynn again, just to Senator Hoffman's comments, all of our employment consultants are continuing to work at RISE because of that very reason. We're helping people because they also have to navigate their public benefits because their changes in employment are impacting that. So there's there's plenty for them to do to support people who are looking for now new jobs or more hours or who just need help navigating this difficult time.
Okay. Thank you. So assuming time works, we're going to go through our list again. Mr. Nichols is up next. And we're going to stick to the 4 minutes on those, I think. Because those are smaller niche sort of things that are very important as well. But then we're going to circle back and just talk about some proposal ideas, since I don't think we'll be meeting publicly between now and Monday night. So Mr. Nichols, welcome to the committee welcome to the Tele-Town Hall. Hello, are you there?
Good morning, and thank you, senators and the remaining representatives and agency leaders. I appreciate you putting all this together, and I will certainly be succinct and brief. Our model really was center-based intensive ABA therapy. We're one of the few in the state that provide the services the way we do. There are a handful of others. We've been impacted much the same as schools and day training or day facilities. We have been shut down essentially from March 18th. We subsequently furloughed over 325 staff effective March 27th, and have quickly been trying to, as the Commissioner Harpstead had mentioned, pivot quickly to a telehealth and in-home model. We had done very little telehealth and very little in-home prior to that. There are some ABA providers that do have substantially all of their work being done in-home model. We have been successful. Initially, roughly 500 families and clients that we had were impacted with the closure. Effective this Monday, March 30th, we had about 40 clients and about 80 families supported through either in-home or telehealth. The financial impact on the organization can't be over exaggerated. It's been significant. We have had some reserves available, and we've certainly been as well pivoting quickly to apply for loans and other relief as were mentioned by a few of the agency leaders. Our broad issues are really a lot of administrative or as it were bureaucratic kinds of changes and things that can be done. Listed that in the written comments, so I won't repeat a lot of those there, but just additional assistance to help us move to that telehealth model. A lot of that was not clearly defined in our particular world, and specifically allowing or waiving as need be the rules related to providing individual support via telehealth would be critically important. And frankly, just overall, I'll touch on the four broad responses that we're looking for. And that really is telehealth and administrative relief. The fixed and ongoing costs in our model, that is roughly about 30%. And then safety of staff, critically important for us. So for those staff that we're moving from center-based back into in-home, we are critically low of PPE related items. We're just not used to operating in that kind of environment with the risks that are inherent in that hand-to-hand, one-on-one contact, and any related safety equipment. And then finally, it's been mentioned a couple times, so I won't go into length to reiterate it, but unemployment relief. So for us as well, furloughing the number of staff we have and continuing their benefits at least through the month of April, if not beyond. That impact is going to be significant downstream as then we learn the increased costs that we're going to have to bear for the unemployment. Our CTSS rates, Children's Therapeutic Supports and Services, that does not necessarily allow for any kind of reimbursement model. It is a set rate that hasn't been changed in, I understand, 5+ years. And so that is a concern for us. So any assistance in modifying that rate even temporarily to allow us to recoup the lost revenue and continue our operations would be extremely important, and certainly very grateful for any assistance.
Thank you.
With that, I'll conclude. Thank you much for your time and for pulling this together.
So the Minnesota Autism Center is an exemplar of many such sites that are just in harm's way. And compared to the categories we had before, there's just a lot of individual centers, and I don't know what to do about that. I do know that the costs that we are hoping to help people recover on their fixed side to stay open are already in the forecast. And so it seems to me that there's a great public interest in preserving a lot of these sites to be open that are at risk of closure. So I think we'll have to leave it at that. And then maybe there's just three not miscellaneous, but just three different places. So Dr. Norman, are you there?
Yes. Good morning, Senators. How are you? Thank you for allowing me to speak today. So I am a small business owner of a company called Live Your Life. I'm a constituent in Champlin. And we're obviously we're going through really some difficult times. Just to give you a little background, I have 25 employees. I've had to lay off half of them. And currently, honestly, looking at potentially, I mean, as sad as it sounds, by April 18th, we may have to dissolve because I don't know that we're going to be able to survive this. And we see pretty much the most vulnerable of patients. We primarily treat currently, because of what we can do, we're primarily seeing patients, so I'm a physical therapist, and we're seeing patients that have Medicaid and Medicare. And with clinic closures now happening all over the state, but a lot here in the Twin Cities, a lot of individuals are really resorting to home care, which is what our business provides. And what we're running into now is that although we've been considered essential and critical staff by the governor's stay-home order, we have facilities, we have group homes, residential homes, we have assisted living facilities, independent living facilities that are denying our entry. And not only us, occupational therapists, speech language pathologists, nurses are being denied going into these homes to provide government-funded care. And so I'm reaching out to you to see what you can do to help me to help access our patients. And we're certainly more than willing, and we have at the facilities that are allowing us to come in, follow protocols. I mean, taking temperatures, questionnaires, wearing protective personal equipment. We're more than willing to comply with whatever they ask, but they're literally denying us walking into the doors to see our patients and helping them stay alive, because we've actually most recently, we had a patient that has been essentially, because they've completely closed their doors for 2 solid weeks, was admitted with pneumonia this past week, and I found out yesterday that he passed away. And that was honestly direct result of inactivity. No one's moving him. There's no hands. There's not enough hands. He was a quadriplegic on a trach that was seeing us pretty regularly, and sadly due to inactivity. And we found out that he was negative for COVID, but because he's not moving, he passed away.
Dr. Norman, did you say one of your clients passed away because they weren't served? Is that what I heard you say? Or did they pass away from COVID?
Well, no, he ended up with pneumonia. He has been inactive, not moving for a solid 2 weeks. So we see him regularly. He gets about 3 times a week, he gets sessions through home care, but was not seen for 2 weeks because they've closed their doors to providers. And so his family feels that is the main reason is that's what the doctor told us is probably due to inactivity. He ended up with pneumonia and sadly died.
I'm sorry, Eva. That's just horrible. That's sad. I don't know. To hear that is one of those stories that you don't want to hear, where we've now stopped this individualized medical help that the physical therapist was doing, and I'm not getting the exercise or whatever it is that I need, and that leads. And I'm saddened to hear that, Eva. I'm sorry to hear that.
Well, we're going to move on, and so Terry Williams, please.
Good morning. I apologize for not being on the video screen. I cannot work the technology, so that puts me in the technologically impaired and needing assistance category.
Welcome to my world, Terry.
I think it's a speed issue, but we won't go there. I first want to just give a shout out to you, Senator Abler, Senator Hoffman, for hosting this Tele-Town meeting. Very deeply appreciated, as well as a shout out to Commissioner Hartstead and the DHS staff, as well as other members of the disability community, those who've been on the call this morning or at the meeting or at the Tele-Town meeting, as well as more for assisting us through this very interesting and challenging environment we find ourselves in. I did submit some remarks ahead of time. I'm going to abbreviate that, pivot a little bit, and focus on a couple of key themes. And so bear with me as I attempt to kind of scroll through these. I'd also like to just add, I'm also, in addition to being a provider and a business owner in Minnesota, and we also offer supports through participant-directed services in 4 other states, as well as HCBS services in California. So that might make us sound like a big, bad organization, but we're not. We're a small business. We're just over the threshold of the small business definitions in previous relief packages. And yes, we are accessing, we've applied for emergency grants. We are talking to the bank about funding for what is yet to come, as well as participating in conversations with the department on what other possible remedies we could consider as we all navigate these new waters. I'm also a constituent in the sense that I have a 92-year-old mother who I have the same kinds of concerns that were just expressed by Dr. Norman, because we have been locked out of her facility now since the 15th. She is in memory care, and so they are exercising the precautions as identified by CDC, which is a good thing. And as are we across the state in long-term care, exercising the precautions that CDC has recommended, and also the Department of Health here in Minnesota. However, that leads to other unintended consequences, such as isolation, such as the loss of critical care or intervention that is delivered by people considered essential, but they don't fall in the category of being allowed into these facilities. So I really do urge you to listen deeply to all of the speakers this morning and really consider what makes sense as we navigate the coming weeks. And we balance the need to protect and isolate as caregivers and as individuals and families, as well as the needs of the people we're all supporting in these varied long-term care settings. One of my biggest concerns has been already addressed by both ARM and the people from other provider organizations, and that is the cost of overtime and pay differentials for direct support workers who are now working at a breakneck pace because there was a shortage coming into this time. We are hoping that DHS and the legislature will look at some form of remedy that is at the very least time limited and focused, and at the broadest, revalues these essential workers. It is our contention that people supporting people in long-term care settings, those working with people with disabilities and the aging population, are not compensated as the consummate professionals who provide very complex care at this point in time. Folks living in these environments are not living in their own home being cared for by family members for a reason. And so I urge us to really consider, what do we do in the short term? And again, what are we going to do in the long term? We have to comply as a company with FSLA and state labor laws. And I can tell you right now that depending upon the extent to which the virus expresses itself within our organization, we do not have the cash flows, nor the reserves, nor the rates to sustain compliance with law for any extended period of time. So if someone gets sick or is positive in one of the homes or environments that we operate, it will very quickly translate into thousands and thousands of dollars of overtime. And so this is a very real concern, and we would hope that there could be a remedy considered in the bill between now, or in language that could be included in the bill for Monday's hearing.
I got to
beyond
cut you
that-
off. Ms. Williams, you're at 6 minutes. So
Oh,
do you have, and is your idea written down?
Yes,
Okay, and so make sure we get that.
yes, I will.
Thank you.
Thank you.
Representative Schultz, do you want to comment on this cluster of 3 testifiers? Okay, Representative Hoffman, Senator Hoffman.
Do you want to go on to the next?
Yeah, we will in a second.
Okay.
Mike Osterholm.
Oh, there she is.
Mike Osterholm.
Oh, go ahead. Yeah, go ahead, Jennifer.
So he's an expert. He's an expert person. He wrote a book a few years ago on a pandemic. Fred. He's at the University of Minnesota. PhD in epidemiology, infectious disease spread.
Okay, that didn't come through very well. So if, yeah, you're not on
send you
video
the
either.
link.
I can't see you, but I can hear you.
Yep.
Do you want to say it again? Just start it over, because I think your first part cut out.
I think we're going to go on, Jim, to...
Okay, she's gone. So
she's gone.
We'll come back.
Okay.
But so, this, I don't know if you can still hear Representative Schultz and if Representative Keel is back, but just as we noodle on what maybe goes forward, I think we need to consider the fixed costs of our statewide industry. We're not here to talk about hospitals and clinics, but likewise for them, some of them have shut down because of essential services and not allowed to do some things they would have been doing. But I think in an effort to capture everybody, I think what we do for the bill needs to consider everybody's fixed costs. And then we'll handle these wages as we can somehow, maybe with the PCA rates or something. But I think that, it might be a matter of $1 billion, but it's not a new $1 billion. It's the same $1 billion we already appropriated.
Correct.
Because if we don't have, so here's Abler suggests we send $1 billion, suggesting we reallocate $1 billion, please. But so that could be productive in making sure that going forward, all of these agencies are available. So anyway, Hennepin County sent a note. They unfortunately couldn't be present, and I'm sure that I kind of just, when we were setting up the list, only one county got a hold of us, and I thought they'd be kind of iconic. But so let's see what Hennepin County has to say. Senator Hoffman, being also appreciating Hennepin County, which is, tries to keep up with Anoka County, has some thoughts.
I would try to say something in response, Senator Abler, regarding when I was on the school board, you guys used to make fun of me saying I came across the Anoka Bridge. Did I bring my visa to allow me into Anoka County? So that I won't belabor that. That goes back 20 years, Jim.
Thank you.
This is from the Hennepin County Human Services folks, and they are actually on a conference call with their legislators and delegates and some other folks within the county, but it asked that I share this with you, Senator Abler, and with others that are listening. And I'll read what Hennepin County sent. This is their response to the Health and Human Services providers that in support during the COVID-19. And Hennepin County is concerned about people with disabilities and their ability to get critically needed services during the COVID-19 pandemic. In response, Hennepin County established a coordinated effort to continue to deliver services as best they can while minimizing face-to-face communication between residents and county staff to curtail the spread of the virus. While we found new innovative way to do work, we remain very concerned about service providers and their abilities to provide services, keep themselves safe, and weather the financial impacts of the emergency. An urgent concern is the financial situation of our disability service providers. Hennepin County has a worry that some of the temporary closures that they are seeing will result in the permanent closures, especially with our day services employment providers. This is from Hennepin County. We mustn't lose the network of providers that residents in the county depend on, especially the community-based mental health providers as well as the smaller culturally specific providers. And while the current slate of the executive orders and the Department of Human Services waivers have been very helpful to Hennepin County, what they are advocating is that the state needs to address the need for flexibility in providing services. Specifically, the legislative action is still needed for support of immediate and direct regulatory and financial intervention. As the workforce issues rise and regulations prevent or delay flexibility and innovative responses to the current time, DHS waivers or license waivers for staff or client ratios and financial assistance will be critical to Hennepin County in order to support them. And as was evident by the emergency legislation action taken by the legislature last week, these are critical times for Minnesota, the nation, and the world. Hennepin County is expending significant financial resources to protect residents from this pandemic and would be happy to talk about the current state of operations, planning for recovery, emergency services, and so on, as the rest of human services topics, all related to the COVID-19 response. So what we're hearing from them is almost the same thing. There's some need for flexibility and clearly not to forget about those people with disabilities.
Right, and the county shortfalls don't fall on a nonprofit; they fall on the property taxpayers.
That is correct.
Who are going to be more stretched than ever.
Yep.
And so I think that's a pretty good statement. I bet most counties would agree with what Hennepin County said. And I just have to step back. You know, I make little comments, but if I laugh or I cry. This is such a serious matter that I try to just keep jovial about it. But this one fellow who died because he couldn't get the right PT at his home, we can't have any more of those. The people that are, what drove Senate File 4200 to come to be was concern about people who would be left languishing without services in their day, wherever they're living, and come to harm. And here people are coming to harm. And so I just wanted to, this is pretty grave.
Looks like
Representative
Jennifer
Schultz, do you want to
Schultz.
offer a thought?
Yeah, I think it's very tragic what we're seeing and what people are experiencing, that people cannot get the needed health care that requires them to stay alive. So we need to take action, and I'm interested in knowing how the Senate is operating under new conditions. I know the House has already had one official Rules Committee hearing yesterday, and we're putting the structure in place to have our committee hearings through the phone and through the internet to have the public participate. And I would like to hear more information on what the Senate is doing and what the plan is if we have a bill, or we can create a bill together, and how that's going to move through the process. Because we have to act quickly. We can't really wait, I think, to go through the various committees for approval.
Agreed.
But if you can share with this community of what your plan is and how you see us moving forward, that would be great.
Well, sure, and I was going to get to that at the end, but I will be quite candid with you. There is no process in the Senate. There's a work group set up of, I think, 11 people. The COVID-19 work group, they're meeting at 1 o'clock and talking about hospital matters today, I think. And they're going to have a roving person who will pop in from time to time and talk about some topic. I don't know how any of that gets ready for Monday. And very frankly, this Tele-Town Hall is the best I could do under Senate rules. This is as official as a hearing as I can get without calling it a hearing. There is little infrastructure in the Senate, and having been a former colleague of yours across the street, the House has been more nimble in this opportunity. So I think in terms of public process, this may be the public process. And I hope we can do better than that. But at our peak here today, 350 people had tuned in to watch this, and we have 15 testifiers and others who are submitting their testimony. So we'll do the best we can. I think it hopefully be better than the last round, where some people sat in a room and didn't do some things I thought we had agreed to. So you can comment if you like, Representative Schultz, but that's the best I got.
I appreciate that information, Senator Abler, and I appreciate you hosting this town hall. I'm wondering, what are we going to do together to bring legislation forward if that's what we need? And are you willing to support additional funding, state funding, that hopefully we can backfill with federal funding?
Short answer is yes. We have 3 more testifiers, so let's go through those, and then we'll get into this very discussion, if that's okay with everybody. So thanks to Hennepin County. We have 2 parents that wanted to comment, and Ms. Kousel, are you there?
Yes, I am.
Welcome. And you have like 3 or 4 minutes.
Yeah, that's fine. Hello, my name's Kelly Kousel, and thank you guys for hosting this town hall. My husband and I have an 11-year-old son who is medically diagnosed with autism, expressive receptive language delay, anxiety, and ADHD. And then I also have a mother-in-law who is in Augustana who has dementia, but the neurologist appointment is until April. So I've also been doing a caretaking for her because I care about that side too. I'm wondering if DHS would be interested in deferring TEFRA fees for 90 days. Obviously, we would pay the money back to give some families a grace period. I'm hearing a lot of families, they're losing their jobs, their income's like all over, and I'm sure the TEFRA department is beyond busy right now because if people are losing their job, then filing for unemployment, I know that it gets very sticky. As well as I'm on the DHS Enrollment and Renewal Committee for TEFRA to try to make it more better and more user-friendly. So whoever suggested getting the new task force for looking at DHS, I would love to be on that, whoever's idea that was. So yeah, deferring TEFRA fees and letting people pay it a little bit longer. I'm wondering if DHS would be willing to reach out to a few individuals who are on waivers and parents whose children who are on waivers to try to figure out what can be done to help. For example, Noah's waiver ends on April 30th, and then a new waiver cycle starts May 1st. So I have about $5,000 unallocated dollars because I have no support staff right now. I have one staff who is under 18. Her mom will not let her work in my home until schools go back to where she can go to school. The mom feels very strongly about that, and the child's under 18. There's nothing I can do. Obviously, I'm very concerned about compliance with law and FMLA and state labor standards. We're under a payroll model, so I don't even know how a PCA or support staff, if they would have filed for unemployment during this time because of the COVID. That's another whole thing. But it'd be nice if we could have a sit down, people who actually use the services and figure some of this stuff out. The other thing is last week I readjusted a bunch of money with my support person who writes my waiver as well as my social worker, Ashley. And then just yesterday, I found out Awesome is doing a virtual conference, and I was planning on going to the in-person conference, but I took the money out of the education parent training because I didn't think there was going to be a conference, because the conference is always the end of April. So can a virtual teleconference be paid out of the CDCS budget? I don't know. Parents in regards to children under 18, over 18, who send their child and loved one to a daytime program, ABA program, any type of like Alzheimer's day treatment program. We need help there. Parents cannot be paid overtime. Is this something that DHS is trying to get parents to be paid overtime, and that's like children under 18? Cleaning supplies. So my child is peeing more on the floor. And I had asked my social worker, he does make messes, but because he's stuck at home, he's making more messes. I can't get any more Clorox wipes or any type of other expenses because it's considered a typical household expense.
So maybe like one more minute, okay?
Yeah, that's fine.
Thanks.
But my son's social worker was able to grant 2 more loads of laundry each week at $5 a load for the last 5 weeks of the waiver. We can't approve virtual staffing, FaceTime, Skype in an unlicensed setting. CDCS does not fund homeschooling activities or facilitate, you can't have a PCA or support staff doing online schooling with your child, which I don't have and I wouldn't do. But I'm just wondering if there can be some rule changes, like the last 30 days of the plan be waived. I've heard you can't do changes because it's already a rule that critical health and safety requests in the last 30 days. And I know families are struggling. I live by Lightworks, Apple Valley. It would be great if I could hire somebody who's now unemployed because their daytime program, but I don't even know how to, I don't even know where to begin or how to do that. So I think it would be nice that actually somebody who's using the waivers and the programs to sit down with these people and try to figure this out.
Well, Ms. Council, I think
That's
we're
all
going to
I
have
really
to.
have.
You've raised a lot of good questions, and I know that DHS is listening. We're not going to be able to handle all those by Monday, but I think we should consider at least some emergency COVID TEFRA relief of some sort. People are being relieved from all other kinds of expenses, particularly when you're not getting what you bargained for in the first place.
You also raised another question, Jim, about, where's in cases like this, get children with special health care needs in their home. What is the school doing? What is the IEP process? How is that processing? And I know we don't want to get into the weeds. That's a whole nother layer that needs to be somewhere addressed in that. So thank you for bringing that up, Kelly.
Yeah, so keep in touch with us. Well, we know you well, so I'm going to have to move on if that's okay. Mr. Rohde?
Yeah, that's fine.
Okay, thank you. Mr. Rohde, are you there? Go ahead, Wayne. Your mic's on, so are you trying to talk? Wayne, are you there?
I don't see him.
Okay. Well, let's if you can get online, just say something. We'll come back to you. Pang Bang, let's talk about PCAs.
Yep, I'm here. Can you hear me?
Yes, perfect. There you are.
Okay, great. So my name is Pang Bang, and I have a PCA agency, Rainbow Healthcare Inc., and then I'm also on the board of directors for the Minnesota First Provider Alliance. And I'm going to talk about PCA a little bit today and some of the challenges that we've had so far from conversations with our members and, like with my agency in itself. One of the first things I wanted to talk about was background studies. And I think some of this has been passed, but we're needing clarification from the department and approval for this from DHS. A lot of the fingerprinting locations have closed, and so we're unable to hire new employees like right away. There are clients who are also refusing PCA services for fear of being exposed to the virus, and so therefore family members are taking care of them. We're having family members who are calling saying asking if they can be paid for this. We can't get them hired fast enough because we can't, none of the fingerprinting facilities are open right now, or at least if they are open, it's just one or two here or there. And some of them are like hundreds of miles away. And so we can't get them clear fast enough. If we could get something from the department, a clarification on this sooner than later, this would go really far to help our staffing. Also on my list to talk about was the 275 hourly max per month. We have right now, as people are getting exposed and getting sick, or they're getting symptoms and quarantining, we can't get anyone hired. And if we do get them hired, because of the background studies, we can't get anybody hired fast enough. So then we're using existing staff. And any existing staff that we have, if they're already close to their 275 max, they can't take on an additional clients. And so getting that 275 hour max lifted would help staff go in there, even if they couldn't go in there every single day. If they could go in there maybe like 2 or 3 times a week just to be able to see if the client's okay, to get groceries, to help them out, it would help a lot. And I think this is also something that needs department approval, but we haven't gotten that. So if that's something that you guys can address by Monday, that would be something that would help a lot we just really need clarification. Some of this department approval. I'm going to save the increased reimbursement for PCA last. It was on my list next, but I'm going to talk about the need for PPE equipment. One, we know that nationwide there's not a lot of it available, so getting our hands on some of them is next to impossible. Two, if they are available, agencies are having difficulty being able to afford them. We were, before the whole crisis, one of the lowest funded or the lowest funded reimbursement rate. And so therefore, our resources have been stretched really thin. And being able to get that PPE equipment is so necessary. We have some of our members the agencies who are in rural Minnesota, they can't get additional staff in there. So they have staff who are going into facilities that require them to constantly change gowns, to constantly have gloves. We can't get any of that stuff. And so we're putting our employees at risk for being contaminated, getting the virus. So a solution or an ask would be additional funding to help either purchase the PPE equipment or to be able to receive some of the PPE equipment from the strategic national stockpile, which we haven't been able to get so far. And then the last thing before I talk about the reimbursement rate is the need for electronic signatures. A lot of our QPs that are unable to go into client homes right now. However, we need signatures. They're required on care plans. They're required on paperwork. Some of that paperwork needs to go back to case managers before we can get approval for services. Without the electronic signature, they're sending it by mail. We're getting it, then we're sending it on by mail to our clients who are then signing it and then sending it back. It's just such a long process that we're not able to get services out there fast enough. We have a lot of clients who don't own computers, or if they do own computers, they don't know how to use them. And so they're unable to sign timesheets. They're unable to sign paperwork. I know the department has clarified that they will not take electronic signatures at this moment. However, with technology these days, original signatures could be done with their fingers if they had a cell phone, if they were able to somehow use that. If they didn't have a printer, they couldn't afford to buy ink, they could sign with their fingers. That's a solution. I mean, that would be an original signature and not just a digital signature. And then the last thing I wanted to talk about was the increased reimbursement rate for PCAs. We were doing some math between some of the agencies and us, and we're looking at, with the $600 weekly increase from the federal match for unemployment and what they're getting from Minnesota unemployment, it averages out to about $15 an hour, which most PCAs are only being paid about $11 to $13 an hour. If we could at least get them to the $15 an hour, we would be able to retain that workforce or even hire more people. There's a lot of things that agencies are up against, not just the wages, but also with the Families First Coronavirus Response Act that went into effect on 4/1. Of course, the benefits are generous. However, agencies have to add on these additional costs on top of everything else. So that is making it difficult for agencies to keep their doors open. Unlike some of the other sectors that have testified before this, that they are closing or have closed, PCA agencies are trying to keep their doors open. We are not closing. And so therefore, we need to keep hiring people, need to be able to keep care so that these clients don't end up going into the hospital. We need to be able to pay just a little bit higher wages, and then to continue to keep hiring and to eliminate some of those barriers so that we can hire them faster would help the industry a lot, help keep clients.
Well, thank you. That was 6.5 minutes, but it was really important.
Sorry.
No, I know. There's only one of you, and there's many providers, so I think you spoke well. And so let's, thank you. And so is the department, they're trying to give flexibilities. Do you see that they're actually working with you to make this, do you see them cooperating? That's not a setup question to make them look bad, but they're trying to be flexible. Are you seeing that flexibility coming through quick enough?
No, we're not seeing it come through quick enough. I mean, we've been in contact with them and working with them, but this approval and this It's just not coming through fast
Yeah.
enough. I mean, we're still waiting. It's been about
Okay.
3 weeks. And we can't, as of right now, I have like maybe for my agency alone, I have 10 new employees I could possibly put out right now, but I can't get them fingerprinted. So they're just going to have to wait. And so
Yeah.
we're getting
They're
some
working on the
responses, but
fingerprinting
it's not
thing.
fast enough.
I know they're working on the fingerprinting thing. Would it work? I mean, I'll throw an idea out to somebody. Couldn't you take a picture of your client and have a timestamp on that? And could that count? I'm just trying to think of something. So I believe the department is trying to be responsive, and that's my presumptive setting on this in the kindest way I can say it. So they just need to keep being as flexible as they can be in flexibility. I know the feds limit them sometime, but this is my urging of them to help you serve people, because as you said, you keep people out of the hospital, and I don't want any more reports of somebody dying because they couldn't get the services because of some bureaucratic thing. That would be just intolerable and unacceptable. So, Representative Schultz, do you want to comment about this?
Yes, thank you, Senator Abler. I'm just wondering if DHS is on the line and if they want to maybe give us more information on what they're doing.
I don't think we have time for that right now. Let's there's one more testifier, and then there's some members online some of the legislators that wanted to say something, and we don't have to quit at noon. That was a target, but it's if the discussion is going well, we can run over time a bit.
And then you and Representative Schultz, I think this bodes to the next level of having a joint, like you were doing your communications before, you should continue that. And I think this gives us to that next level. And thank you, Jennifer, for doing that.
And I think DHS's response would be a long discussion with you and them and me and them, probably separately. Thanks, Ms. Vang.
Thank you.
Mr. Rohde, can you make your comments in about 2 minutes? Welcome, by the way.
Yes, is that okay? Can you hear me?
Yeah, you sound great.
Okay. Thank you very much, senators and representatives and commissioner. My name is Wayne Rohde. I live over in Maplewood area. I'm a father of a 22-year-old son with autism. Real quick question, and it's really centered towards the commissioner. I've spoken to many families who are very concerned about having their upcoming annual in-home assessments. And how is that going to be delayed, or can those assessments be extended out with current budget hours and dollars? That's just my question. Thank you very much.
Okay, and so that's been posited, and I just want to.
Senator Abler, this is Kelly. Wayne, the answer to your question, because I just had my assessment done, is they do it over the phone. DHS is waiving it, so they're doing it over the phone. They're mailing the paperwork, and then you got to mail the paperwork back. Sorry.
So there's a success story, and so this is meant to be a positive Tele-Town, whatever it is, whatever it's called. I think, and I just want to comment, on my Facebook stream, there's been 400 people on that. So I think and whatever been on other members' streams. So we're pushing 800 people that have been a part of this hearing, this Tele-Town Hall thing, which I think is remarkable. I think right now we'll open it up to the other legislators that are on the phone and offer them like 2 minutes if they want to offer a comment, and then we'll go into a discussion about where do we go from here. And so, Dave, if you want to open up, how many are on there? Is Senator Dietzick on there, for instance? No.
Senator Ralph?
Senator Ralph on there?
Yes, I am.
Oh, there's Jerry.
Okay, Jerry, you got 2 minutes.
Okay.
Thanks for being part of this.
Thank you.
A lot of content.
And I think there's a lot of good ideas come out of this. I want to circle back offline with you. I want to thank all of the testifiers. I mean, these are important issues. I've been working on some stuff, as has been mentioned, and I want to sit down offline and talk about that to see where we can get. I think just right now we've just got to move forward, and I think finding a forum where we can, in the Senate, have some way of vetting this stuff and getting it on the floor. We need to do something with that. So I will work towards that after we get done here and get offline. But just thank you for holding the meeting.
Oh, Jerry, thanks. And I know you're working on the PCA rate bill, and I think that's got some legs. So Dave, is Senator Nelson there? Anybody else you recognize it? Senator Nelson, are you there? Any other legislators that are, why don't you, so that's, I think, who came and went. And so just so people know, different legislators requested to be on here, and we gave every one of those legislators who requested to be a part of this Tele-Town Hall.
You're getting it, Jim.
The access that we just mentioned that Senator Ralph had. So I'm pretty happy that we were able to accommodate those. Yes.
This is Deb.
Oh, good.
Keel.
Welcome back.
Yeah, thank you. I've been listening for quite a while. I think that I hope for the Commissioner Harpstead that this has been very helpful in hearing what's going on in different areas. It's important. I know I will spend some time talking to my local areas to see how things are working. Are they getting what they need? And some of this almost seems to be a little bit of just knowing what you can and can't do in your situation. I think a lot of questions about that, but then also just being aware of what isn't working for us in different parts of Minnesota. So I thank you for putting this together. Commissioner Harpstead, I'm really hoping we can work on this non-medical emergency, because I'm a little more than concerned about people being able to get to dialysis and just some serious things that need to be handled, cancer treatment, those types of things. And thank you for putting it on.
Thank you. And so, Representative Schultz, we have some work to do offline. I know the commissioner, I just heard the commissioner canceled something to stay a part of this, which I really appreciate. And so why don't you, Jody, do you want to come back on and offer your thoughts about what you've heard? I think you're unmuted now. So if you're there, please come back.
Yeah, I want to thank you again for setting this up and this opportunity to listen. And I really appreciate everyone who has come on and contributed. I've been taking copious notes. If it looks like I'm actually checking my cell phone, it's because I'm sending many of your ideas to people in different places in DHS to be sure they're working on them or to consider them and to ask questions. We are working on many of the things you have asked about. We are starting to put together a more comprehensive approach to finding a way to get PPE arranged for nonprofit providers across the state. We are within days of guidance on background checks, and some of the other things that I've heard today. We're listening, and some things, as I've mentioned, our executive order does not allow us appropriation dollars, and so it's back to the legislature to sort out whether there's any additional funding for some of the things you've asked for. And I heard you all. I've taken lots of notes. We'll take them back into the department, and we are working 12-hour days and weekends to put these decision guidance up on our website so people know what to do and how to handle things during this unprecedented time. So just really want to appreciate everything you've all talked about and sent in here today, and keep the ideas coming. Thank you.
Thank you. And so, Jennifer, Representative Schultz, do you want to offer a thought? I've got some things that might be considered closing comments, but Representative Schultz, do you want to offer what we'll call your closing comments?
Well, I just want to thank everyone again for participating and sharing stories with us and their needs. And I'm looking forward to working with Senator Abler, Senators Hoffman, Senator Ralph, and others to put together a package. The House has been driving a lot of legislation, so I'm looking forward to working with the Senate.
Nice. Thank you, Representative Schultz, for that. The bicameral, bipartisan, county thing. And also, Commissioner, thank you. I hope one of the takeaways is if there's something missing that you need statutorily that we didn't get, that's, I guess, a time for us to step in and help you achieve that, because our intent of Senate File 4200, of course, was to give you the ability to have flexibility within that, and if there are some missing pieces, we want to do that. I like the thing about, you weren't given the piece of appropriations yet. I think a lot of the ideas that we're hearing, I keep coming back to is already forecasted dollars. So it's not any new money. So help us help you figure out how we can help get that opened up for our service providers within the full state area. And I think going forward, this is a partnership that Senator Abler and I and Representative Schultz and the other folks have said to you all along, commissioners, we are here to help you get through these times, and we appreciate your leadership that you're doing, and thank you and the governor for taking 4,200.
Yeah, and so this has been, I think, remarkable. We heard from 15 individuals who represent thousands and thousands of providers and parents, and we didn't hear from the clients much. I would actually have liked that, but we just couldn't pull that together. And so, but I think the level of cooperation that we're seeing here is just remarkable. Between the House and the Senate, the administration, Republicans and Democrats, I don't think this knows any partisan or political boundary, worrying about the welfare of the maybe 100,000 individuals that we're concerned about that are in harm's way through no fault of anybody. And I appreciate the department's quick response, as quick as they can. Compared to their usual how things go, they're just like a race car. And so we want to put some fuel injection into that, maybe if we can in some ways. But Commissioner, I just want you to think about something. And as I mentioned before when I talked about these fixed costs, I believe you have the authority to spend money, new money, based upon the, what was that number, Executive Order 2012, which is the equivalent of Senate File 4200. There's a precedent. There's already $103 million gone into various increases in the forecast for Medicaid re-enrollments and the likes of that. And so I'm very interested in a statewide fixed cost remedy. Every penny of those fixed costs are already paid for in the forecast. Correct. And I think if those could be reallocated or just redefined some way, and I think Representative Schultz's comment about trying to get the federal match to stay intact is important. But there could be a short-term change, which then could be canceled and paid back in some other way. But I think the providers need to know that help is on the way. And I think that some vague form of help is on the way. But for my money, I think, and in terms of the statewide infrastructure, the hospitals have lost, somebody said, $1 billion. They lost money that was in the forecast. And so that's going to show up on the bottom line as money available, but it's not really money available. It came out of decimating these various service groups. And so perhaps there would be a way that you could do that, Commissioner, and I'll just leave this as a open, friendly thought about that, without requiring us to do anything formal. And if we need something formal, then I'm all in for that. And I think with what the House is doing with the PCA rates and some of these PPE business and all that, I think the money is mostly in the forecast. And so even it's going to amount, this might amount to $2 or $3 billion or more to handle what would have gone out. But the lack of having that be present will mean that there'll be more stories about this man who died and people who are gone back to institutions, and there's no place to go from their group home or from the ICF, or we have to open up new places that are far worse than what we had to serve individuals. And so, and I really appreciate all the people's comments, and I appreciate and the help, and I appreciate Dave from the county and Commissioner Sivaraja, who opened her door, and Kevin and Tom, our legislative assistants, and Brittany and all the staff that put this together. Yeah. And oh, my mom, hey mom,
hi, Sandy.
she wanted me to say hi.
Happy belated birthday.
She's watching in Florida, but I think getting a time when 800 people listen and engage in a dialogue like this, and the concerted attention of the commissioner, and I'm sure a number of the DHS staff are watching. And we're also willing to work 12-hour days. And so Representative Schultz, I commend you for your work, Representative Keel, Senator Hoffman, and Senator Ralph for being here. And so, and I'm going to actually, my cell phone is published in the Red Book, so don't be shy to call me if you need me. And I'm sure that the rest of us are equal. I won't volunteer Representative Schultz's cell phone, but I know that we read our emails, and we do care. And so, and so, oh, by the way, all the documents, this is an unofficial meeting of the Senate, and so we have to use casual methods. All the documents that you wanted to, that were presented by the testifiers and the people who couldn't make it are going to be created in a link that Kevin is somehow going to magically have happen. And that'll be linked on my Facebook page and Senator Hoffman's Facebook page. And we'll get that link over to the House and they can post it on an official site perhaps or somewhere. But these are documents from the public. It's not from just this random meeting. These are 25 people or more. And if you want to send your own document in that you didn't think of to write, tell me your problem, but put a solution at the end. And together, we will get this done. And so all I have for you is an air gavel because it's not a real meeting. But God bless you all. We are in this together, and may we succeed in looking after Minnesota.
Thank you, everybody.
Thank you very much.
Thank you.